6 months in India. In the last 24 hours, India has reported 10,158 cases, and there has been a jump of at least over 3,000 cases that were recorded yesterday. That stood at around the 7,000 figure mark. Right now, the active caseload stands at 44,998. Meanwhile, the World Health Organization also has been talking about the new COVID variant, which seems to have new symptoms in children rarely caused by other Omicron subvariants, and it has also been dubbed as Arcturus, which is XBB.1.16. That seems to be fueling the new surge in many of those countries, including US, Singapore, and even Australia, among others, where this new variant has now been dubbed, as far as they have been monitoring the situation in late March, saying that this is one of the most transmissible variant as of now. But however, the only good news that is coming across, despite those uptick that has now been mentioned and recorded in those corona cases, as far as the hospitalization is concerned, that has been bare minimum. Even though, as far as the precautions also being taken by the government, there have been several mock drills that have also been conducted. Let me go across to Dr. Roy, who is with us here on the broadcast. Dr. Roy, good morning to you. It's been a jump of at least 10,000 cases, sir, that has been recorded in the last 24 hours. Dr. Roy, how do we see it?
Good morning. I believe that this is a cause of concern, and I do believe that each and every person needs to realize that the pandemic in its way may have ended, but the endemic outbreaks of COVID are still continuing. We've had over 3.3 million cases across the globe just in the last 28 days, and what we are seeing in India is a follow-up to the spike in cases that was seen in the US and other parts of the world with new variants called XBB 1.5, which is being called the Kraken virus, and also with the increase in the XBB 1.16. And recognizing this, we have to realize, though the severity of the cases and the hospitalizations are not as many, the evidence that the infection is affecting people is going to lead to ongoing long COVID cases is really a cause of concern and something that needs attention at all levels, right from the public to the government.
But Dr. Roy, does it mean, as far as those senior citizens or people who have comorbidities or even children will be the most affected one this time around too?
It can definitely be anticipated that senior citizens, people with chronic ailments like diabetes, hypertension, heart disease, chronic kidney diseases, chronic liver diseases, autoimmune diseases, potentially even lung and chronic respiratory diseases could be more affected, as we have seen in past waves of this virus. Children seems like maybe at an increased risk, but we are not seeing as much of severe cases we didn't see in the previous episodes also, and not now. But certainly because the pediatric vaccination or immunization in COVID is not as widespread as we have had in adults, we could anticipate a little spike in pediatric cases also. We are certainly seeing it even here in Mumbai. It's very much there, and I think all age groups are getting exposed, but the ones who are least vaccinated or highest at risk are the ones who are having the most likelihood of getting infected.
But Dr. Roy, there have been certain medical experts who have also been saying, and this could be probably in the coming 10 to 12 days, India would see further jump in the cases, but would also naturally see an equal dip that will also be reported. How do you see that kind of a movement in graph that is also being talked about? And how do we also differentiate in those people who are catching the viral flu in terms of the symptoms, and how do they continue to get their checkup as far as the COVID cases that are also concerned? Is there a difference, sir?
So in terms of symptoms, it is very hard to differentiate these two viruses because the newer variants of Omicron have been causing sore throat, fever, cough, cold, very similar to what we would see with an influenza infection, whether it be the H3N2 spike or the swine flu spike that was seen earlier. So in these situations, it becomes very tricky even for physicians. We are always left with that question, do we empirically treat people as influenza because we have medications to treat it, or we go in for investigations? I think the need for investigations is very obvious here. And if someone has any of the comorbidity or high-risk factors or or it is a child who potentially could get quite sick with it, it is important to investigate these viruses. There are good, reliable nasopharyngeal swabs, rapid antigen tests that are available, and I think we need to rely on them even more so to differentiate and then potentially treat appropriately.
All right. Thank you very much, Dr. Sitesh Roy, for a well-detailed explanation exactly what we are actually looking at and facing in the current times there. Let me also bring in our reporter. We have Akansha joining in at this point. Akansha, it's been almost the spike that has been witnessed in the last 6 months as India has crossed over 10,000 cases being reported in one day.
Well, absolutely. There's been a massive uptick in the cases. In the last 24 hours, the country has reported 10,158 cases, 11 deaths, and the active caseload has increased to 44,000. Now, this is there's an increase of 30% in the cases in the last 24 hours. Yesterday, remember, we reported more than 7,000 cases. The day before that, there was India reported over 5,000 cases. So, as you can see, there's a steady increase in the cases in India. In the last 24 hours, we saw 10,000 cases, which have been the highest since August last year. But yesterday, Health Ministry issued a statement saying that there's nothing to worry about. This COVID is not the worry right now because XBB.1.16 is the Omicron subvariant, which has been circulating
and said to be one of the most transmissible ones. However, we are looking at something that fortunately not many hospitalizations till now have been reported. However, mock drills and preparedness and precautions on part of the state governments, we are told that several measures have already been undertaken. For the moment, Akansha, thanks very much for joining in. We will be back after a short break. You're watching the Morning News Hour. More news and updates continue on the other side. Stay tuned.